Good morning, everyone, and welcome to this special lecture. We're delighted to host Mary Wooley, the president of ResearchAmerica, the nation's largest not-for-profit membership-supported grassroots public education and advocacy organization that's committed to just what we're committed to, medical and health research, making it a higher national priority. I first got to know Mary while I was at NIH as the director of the National Institute of Diabetes, Digestive and Kidney Disease. And one of the memorable things of my stint there was testifying on multiple occasions before Senator Arlen Specter, the late Senator Specter, a true champion for biomedical research and for NIH and for public health in this country. And it was a dinner, one of the annual dinners hosted by ResearchAmerica, an awards dinner, where I learned some of the fascinating details about how Senator Specter got his start. And in fact, the anecdote he described had to do with the fact that he was apprenticed to a cardiologist. And it turned out to be, don't get the wrong impression, so mundane and boring for him that he went into something else. He went into law, and we're all the better off for it, although he probably would have been a fantastic cardiologist. But the important point was that this dinner and the awards exemplifies the kinds of activities that ResearchAmerica and Mary Wooley champion, so important as a valued, rigorous, objective in this era, messenger to our public and also gauger of the public sentiment about what they do. It always struck me as peculiar that while the public was well aware of the acronym NASA, for example, they had very little clue as to what NIH was. And I think we're going to hear from Mary Wooley, each and every one of us, faculty, investigators, educators, medical and graduate students, physician scientists, the role that we can play. She's had an illustrious career, bachelor's degree at Stanford, a master's at San Francisco State University. She was involved early in her career in some of the largest clinical trials in the Bay Area and became eventually CEO of a San Francisco Research Institute, moved through various stages, and since 1990 she's served as the president of this important organization. Mary, welcome.
Thank you. It's a great pleasure to be here with you and as a guest of Alan's, who, as he indicated, I've known for a while now and admired and continue to admire your leadership, Alan. It's really a tribute to you that important things are happening in science. Let's take stem cells, because people like Alan has stood up to be heard from. And that, however, I want to use as a segue as to one of many things that are being challenged right now in science across the board, as well as medical and health-related science. And as a messenger from Washington, so to speak, I'm happy to tell you that not all the news is bad, but some of it, of course, is, and you know that. And that's why we've really made an absolute commitment in the last couple of years to spend as much time as possible, my colleagues and I, talking to the on-the-ground, if you will, future of health and research in this country, all of you and your colleagues across the country, to encourage you to get involved and not count on organizations like ResearchAmerica, which I'd have to say I think is doing a great job, but it's not enough. But to get involved personally in the important work of advocacy, which is changing hearts and minds. So this lecture is, in my visit here today, is made possible by the Kavli Foundation, which you may have heard of. They give very distinguished awards in a sort of wannabe like the Nobel kind of way. But they also have been developing a part of their mission, a new part, which is involved with public outreach and engagement. And that's where we fit in. So I am privileged to be here with their support. Now, I mentioned that changing hearts and minds for research really is what my definition of advocacy really is. And it's not anything that you need to go take a class about. It's the simple and important art of persuasion. And that starts with building relationships. And of course with sharing evidence, which you know quite a lot about, but also making it just a routine, normal part of the culture of science and of discovery. You know how to reach a community and touch people where they live. These are some examples that we culled from information as my team and I took a look at the opportunity to come to Einstein and Montefiore. So you know how to do this. This entity, the place where you are every day, the place where you're leaders, the place where you're conducting research, has a strong history and commitment to community engagement. It's another level out from that, and perhaps embedded in it, to assure that there's conversation that occurs every day by everybody about the importance of research to the future of health, to better health and quality of life. A lot of places that I've visited all across the country recount versions of the following story. This was in Nebraska, where I was invited by the dean there to come and give a similar kind of talk and meet with some people. And in the course of it, he told me that he had heard me speak some years ago about the relative invisibility of research around the country. And Alan alluded to the fact that people know what NASA is, but they don't know what NIH is, et cetera. So what happened as a result was when this particular dean built a new research building, he put the word research in 10-foot high letters on top of the building, 10-foot high, and said that he was stunned after that at the number of people of all walks of life in Omaha who came up to him and said, "I didn't know you were doing research there at that medical center." They had no idea. They didn't know. There's nothing obvious about doing research. There's a lot of buildings, but unless you talk about it, some people who don't have that top of mind, you know, what's the function of a medical school? Well, to train future doctors, of course. Not necessarily thinking about research. So there's very easy ways to win hearts and minds and to build in conversationally and as part of other activities a discussion about research. So why do advocacy? Advocacy works. Advocacy changes things politically and otherwise. And there's some examples here of some of the advocacy work that we've been involved in at ResearchAmerica over the years. And of course, many, many other people involved as well. But I like to also point out that it's been patient groups over the years that have been not only instrumental, but often the leads in the most dramatic increases of commitment of public dollars and public policies in support of research, going back to the March of Dimes. And then fast forward to the tremendous efforts that were behind what became known as the war on cancer, and to the HIV/AIDS activists who wanted things to move faster than the science community even thought was possible at the time, and that the regulatory agencies, FDA notably, were skeptical they could keep up with. But it was insisted upon by the public, by activists who cared about life and death challenges. Women's health is another example in that regard. So partnerships with the patient community is critical to everything that the research community aspires to accomplish. Now today in Washington, and it is changing literally hour by hour in Washington, I'll get to the funding challenge in a minute, but as we look at the landscape and try to frame it for our advocacy work, there's some really stunning things that have happened that I've never seen in my career, like the March for Science. What an extraordinary outpouring of support, not only by the science community, but by many, many other people. There was one survey done that indicated that 2/3 of the people who came to the Washington March for Science last spring were not scientists themselves, many families, of course, but all around the country. It's going to happen again, by the way, April 14th. They just released the date. And we're very happy to be strong partners with the March for Science. We do have strong leadership in the Congress right now that cares about the NIH, cares about medical and health research in ways akin to Arlen Specter back in the day, John Porter, and others. And there's quite a number of them. That is extremely good news. And many, many of us work hard to bolster that and to grow the number. And you can too, I'll get to that. As you know, science aligns with a lot of objectives, not only health, of course health, but many others. And learning how to say that is important too. And I will show you some data to confirm why people want to hear you say that in a few minutes. So the challenges are many, 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 but they include a couple listed here. And then, of course, there's money. So in terms of the funding state of play right now, the media is talking about tax reform constantly, and there's implications for science in that bill. But the actual funding bills are moving along slowly, ever so slowly, way behind schedule at the same time, not necessarily in the headlines. And here it gets very complicated with a lot of inside the Beltway jargon, like continuing resolutions and sequestrations and things that are slowing down science and thus slowing down medical progress, and thus compromising the hopes and dreams of patients everywhere. It shouldn't be happening like this. But versions of exactly this scenario have been happening for the last several years. And that has implications for many, many strong American priorities. The one that's really the priority that's really driving the Congress to get this bill done, to fund the government, is defense right now. And that will finally push this bill through. The challenge is whether other important American priorities are going to be strongly funded as well. And the jury is out on that. There's something you can do about this. It's getting involved in the Raise the Caps campaign. And if you happen to have your little handy handheld device with you right now, do it now. Tweet at your elected representatives and tell them it's time to raise the caps. You don't have to do it right now. But it's a pretty simple thing to do sometime today, and it's important. It will make a difference. We've got to raise the artificially imposed caps that go date from 2011 that hold down funding at a time when Congress couldn't make a decision that time. That's the law right now. If it actually kicks in on the 22nd of this month or on the 19th of next month, there'll be severe cuts across the board. It won't be good news. And if there are cuts, and in fact, if there aren't regular, sustainable increases that match the capacity and promise in science right now, it's going to hurt your career. It may have already. We just haven't made research for health the priority that it ought to be in this country, but we can get there. So I'm going to show you a few of the little highlights from regular surveys that we commission. We don't, sometimes people think that we conduct public opinion surveys. We don't do that, but we commission them regularly, and we have been doing that for over 25 years now. So we have quite a lot of interesting trend data, as well as regular samplings of new data and sometimes state-by-state data. So I think this is quite amazing, especially the 9% increase that we've seen in the percentage of the American public who think it's very important for scientists to inform elected officials and the public about their research. That's you. You know, the public wants to hear from you, and they want, by the way, policymakers to listen. We'll see that too. The public agrees, says yes, public policies should be based on the best available science. And by the way, when you look at anybody's public survey data, whether it's commissioned by us or anybody else, you should always, always, always combine strongly and somewhat agree. And similarly, on the other end of the scale, strongly and somewhat disagree. Just because of the way, and it's been well studied, the way that consistently there are some people who just won't go all the way to yes. They'll say maybe yes, you know, and on the other end too. So you always combine these. That's the way political people think, and that's the way you should think about survey data. So here you see that public policies, this should be 100% right. Of course, evidence should underlie all policy decisions, but there's been sufficient questions about that we decided we ought to start asking about it, and we did a few years ago. Well, it turns out that when you ask people whether scientists should play a role in shaping policy, it applies to all these different areas. That there's an evidence-based, a science-based component to policymaking in all these areas, and more for that matter, but these are just the ones we asked about. Remember to add strongly agree and somewhat agree. And you can see it's pretty much across the board. And yet that's not what's happening. Not every member of Congress has a science advisor or a fellow or somebody who knows about science, and admittedly, perhaps only one kind of scientist, but has networks to know where you can get other science advice. That is by no means routine in the Congress. Science advice is hard to come by, and first of all, you have to go looking for it often, which people don't have time to do, busy members of science. But it's the public's expectation that it happens. And that's where the change can come from. The public also thinks that elected officials ought to listen to scientists. This is a very useful piece of survey information with a big increase, stunning. We don't usually see that level of increase year to year or every couple of years even. This is useful in talking to the staff of members of Congress and occasionally to a member themselves or to the media. Keep that in mind. There's many more members of the public who are non-science trained than those who are, many more, several times over. But they want elected officials to listen to the scientist's point of view. This is an example of a member of Congress, now the chair of our board at ResearchAmerica, who listened to scientists. Was back in the days when, that time, and happening again, when stem cell research was being challenged, embryonic stem cell research in particular. Mike Castle, a moderate Republican, stood up and fought for stem cell research, and he's doing it again today. And with Diana DeGette, who is still in the Congress, a strong ally, a nice bipartisan team that listens to the science community and is quite influential, both of them, in their own party caucuses. And Mike Castle, whom we refer to as Governor Castle because he was also a governor, is a splendid, splendid spokesperson for research. So if you're like most people, you've heard a lot of skeptical voices raised. You've heard about them directly and indirectly via the media about, now wait a minute, are we really doing all we should be doing in science? I mean, what's all this? One food is good for me one day, eggs, good for me one day, bad for me the next day, red wine, good for me one day, bad for me, et cetera, et cetera. It often comes up about food. But also plenty of skepticism about other research findings, either because they have funny sounding names, shrimp on a treadmill, et cetera, or because it sounds like we're wasting money, because it's been a long time since we actually once and for all defeated cancer, or lots of different skeptical questions. Well, in my experience, many people in the science community essentially give up at that point and avoid even getting into conversations. But that's a horrible response. The opportunity is to run toward it. For example, you sound like you are skeptical about what we were just hearing, whether it was on the media or something. And the person says, yeah, you're darn right I'm skeptical. Well, I was trained to be skeptical. That's how scientists are trained, to ask questions, to poke at what's being said or posited or the evidence so far. You can have a completely different conversation with someone whom you might perceive as negative to science or to you. You can find a way to connect to them. That's about that building relationships. By embracing that skeptical voice, you can make friends. You can win a heart and mind. It's also very common for people to misunderstand the scientific process, thinking that it's linear. And those could include political decision makers too, because we all would like to think that's how it works, more of an engineering kind of approach. But there are plenty of opportunities to help people understand that's not the way it works. I like the idea of saying to them, you know what, you're watching science in real time. That didn't used to be possible. But we in the science community have always known that everything is a tentative next step, and lots of times there's reversals. But the sort of catchiness of science in real time is, again, it's another way to connect to people who may be skeptical or worse. But walking away or failing to engage is not a good answer. It's often said, and there's some evidence to support this, that talking about the economic benefits of research is effective with many people, especially many policymakers. And indeed, that is correct. It doesn't matter to some audiences, it certainly does to others, but just being aware, as I know you are, but being aware that you may have opportunities just in casual conversations at family gatherings or socially, lots of ways, to just point out the economic value of research. The great jobs that are associated with science-based industries, new companies, all thick on the ground. So there are just a few tidbits from New York, but of course it's true nationwide. But speaking of New York, you all, if you don't know this already, you should know and be proud of the fact of Einstein's ranking among New York institutions, and these are just the top 10 here, there's more, of course. And being proud of that is important not only so you feel it and want to continue to earn it, but so you can talk about it, including to your policymakers, and perhaps again to family members, friends, people you meet for the first time or have known for a long time, may not realize what a powerhouse institution this is. And it's often interesting to look at other states that are thought of and are leaders in NIH funding support, NSF, CDC, ARC. These are the agencies that we work with most closely who do give at least some extramural grants. And New York does extremely well here, extremely well. And I'm sure will continue to do so. But again, it's bragging rights. You should feel good about it. Some things to worry about, however, include this presentation of NIH funding over time in both current and constant dollars, with a little blip there for the ARA supplemental monies after the economic collapse in 2008-9. At the end there, over in 2017, you can see the very red president's budget that was proposed by the president last February. And we're told that something similar is going to happen again this coming February. cuts, and whether they'll be justified or based on cuts to indirect costs again, possible. But certainly that's what the word on the street is right now. Now, the House and the Senate don't like the president's budget for NIH. They didn't like it last time. They have a history of not liking the president's budgets, whether it's been President Trump, President Obama, President Bush, President Clinton, and President Bush before him. That's very common. It's actually very common. There is no, we've done an analysis to see whether in a certain president's term of office, was there disagreement with the Congress on the budget for NIH or not, and it's really almost random. You can't really track it. There's too many other factors going on, I suspect. But the point I like to make here is be prepared. There's going to be another negative president's budget, but also where the real action is with the House and Senate, because, of course, constitutionally, they are responsible for setting the budget, not the president. It's often said the president's budget is dead on arrival. But it's a statement about priorities, gets a lot of attention, And it's always a goal of ours and of all advocates to have high budgets coming out of the president's offices, OMB. Now, our chair emeritus, and he was our longtime chair after he left the Congress, often says to scientific audiences that you can change the image of things to come, including the president's budget negative numbers. But in this case, he's talking about the Congress and urging members of the science community as individuals, not through their agents or through alliances like ResearchAmerica, but also as individuals to reach out and build bridges. How important are NIH leaders to NIH funding? They're critical. This is the NIH campus, the main campus in Bethesda, and you can see here the names on the buildings. And you can see that they're more or less comparable, Democrats and Republicans. A lot of people have the misperception that it's Democrats who are the staunch supporters of NIH, of research funding. That is not true. It's both parties. This is truly a bipartisan concern and interest. So I do like to point out, though, that there's still a lot of buildings that don't have names. So there's room for more champions here on the NIH buildings. And the campus is actually much larger than this also. There's plenty of room for more champions, but they're very special people. They have to really make NIH their number one or one of two, maybe maximum, issues that they're going to bat for, whose legacy, they want to be part of their legacy. We have two of those people right now, one in the Senate and one in the House. So my prediction is that not too long from now, there will be a Cole building on the NIH campus and a Blent building. That's the level of commitment they have. And I certainly hope that they prevail on their fellow members to stay with them and be supportive. And you'll notice where these gentlemen hail from. Not from the 4 top states that receive NIH funding. Actually, their states are quite far down in the rankings. They do wonderful science. No, that's not the issue here. The point really is that caring about medical and health research as your number one legacy issue is not confined to people in where you might think the obvious spots are. If you ever have time to thank these gentlemen after something really important happens, like when we get across the finish line for the federal budget this year, which probably won't be on the 22nd of this month, but might be on the 19th of next month, and NIH does well, a big part of the thank you is due Senator Blunt and Mr. Cole. So often when I'm talking about advocacy, people hear or conflate it with lobbying. And let's be real, the words are used interchangeably. But there's lobbying with a lowercase l and lobbying with a capital L, where there's legal requirements, registration, etc. We do some of both at Research America. Very little capital L lobbying, mostly advocacy. But just to be sure we're on the same page here, it's important if you're thinking about, and I hope you are, reaching out to your elected representatives or to superstars like Senator Blunt and Congressman Cole, that you should be careful how you do it. Because you can do it and should do it as a constituent who happens to be employed by or is a student at this very institution, Einstein or Montefiore, but you can't do it on letterhead from those institutions unless it's part of your job to do it. And if it's part of your job to be a lobbyist for this institution on letterhead, you'll know that. So if that isn't part of your job, don't shy away from reaching out. Just do it as a constituent, as an individual, as someone who cares, who lives in this country. You're more than allowed to do that. It is your First Amendment right. A little bit about background about Research America. Alan mentioned that it's our mission to make research for health a higher national priority. And we've been around now for 28 years. We're an alliance of not only academic institutions, but patient groups, whom I mentioned earlier, are so important, arguably the most important force in advocacy. Also industry and scientific societies. And you can read the rest. We have a spectacular board of 36 people, only a few are listed here, but there's 5 former members of Congress from both parties, 2 former agency heads, Elias Serhouni and Mark McClellan, and representatives, leaders from the very elements of that alliance that I already described, plus some people who are quite knowledgeable about advocacy and about media. So now, however, it's your turn. So this is what I call the Starbucks test. I noticed looking out the window, you've got a Starbucks right down the street there. So imagine you are, let's say on a weekend, at Starbucks or your local coffee, whatever, or someplace in the community where you vote or live, and your member of Congress, not your senator, your member of Congress is there on the same errand. So raise your hand if you recognize that person by sight. Got some hands. This is good. Okay, second question. It really should be all of you, by the way. But second question. Raise your hand if your member of Congress recognizes you by sight. Oh, that's your job. Right. Okay. Well, that to me, I think we had 2 hands, maybe 3. That encompasses what our problem is as an invisible constituency that is working to accomplish one of the highest priority goals in this nation, better health and quality of life. We're invisible to the very people who can make that happen. Now, for sure, a member of Congress walking into a Starbucks, first of all, making a decision to even go into Starbucks rather than stay home and make their own coffee, because they're a politician, they expect to see a lot of people they know. They expect to talk to a lot of people. They expect to meet new people. They're out there with the voters. It's part of their job. It's part of their passion for their work, to stay in touch, keep a finger on the pulse. They know a lot of people who are small business owners in the community. They know a lot of people who are involved in the religious institutions of the community. They know a lot of people in education, in banking, in real estate. It goes on and on and on and on. And just folks. But they don't know people in the science community, and they tell us that. They tell us it's got to change. It's got to change. But I like to think about what scientists and elected officials actually have in common. And you may think you have nothing at all in common with your own member of Congress or other elected officials. Disagree with them about a lot of things, etc. But you do have something in common, and that is serving the public's interest. That is what elected officials do. It's also what you do. And just remembering that is the easiest way to start a conversation with your elected representative, who you will soon remember because you know what they look like. You'll be able to go up to them and thank them for their service to the public and say, that's what I do too. I also serve the public's interest. And they're going to ask you questions because they're politicians and they want your vote. You don't have to get into what you're doing in your lab unless they ask. But you can form a relationship, and that's the basis for changing hearts and minds and for advocacy. The odds are that member of Congress will ask you a lot of great questions, and then you can invite them to come visit you in your lab. Anyway, here's a few of the representatives in the immediate area here. And these may not be your representatives. Very easy to look them up online. You just put in your zip code, really simple. Believe it or not, I don't want to exaggerate here, but at least once a month, somebody from the science community will call up or email us at ResearchAmerica and ask how to find out who their member of Congress is. I mean, really? Siri, who is my member of Congress? You know, Siri will ask you for your zip code and tell you. This is learned helplessness. It's learned helplessness in the face of the political universe. The political context of science is the context of science. The public and political context. It always will be. That's where the money comes from. That's where the policies come from. And they could be policies that impact philanthropy, policies that impact business, etc. There is a public and political context for science. It's real. And we shouldn't feel helpless in the face of it. We should be engaged with it. You probably know what your senators look like, right? Specific things that you can find out about and ask your member of Congress to do, to demonstrate that they support the National Institutes of Health, because they will probably tell you that they do. And actually, those people I showed you pretty much do. But they aren't all active in it. So, for example, what can I do if Mr. Crowley says, what can I do to help you out here? You say, well, according to my information, you're not a member of the NIH caucus. It's a group of people who, in the Congress, who said, I believe in X issue, and put my name on it. Pretty simple thing to do. And that way, if they decide to join on, if they are not currently on, they're making a statement. And they're going to think about NIH more maybe than they did before. And there's other examples here. There's an asterisk on Senator Schumer because typically the leader, whether it's majority or minority leader, does not sign on to this kind of activity. But otherwise, I think you get just kind of the idea of things you can ask people to do, simple things. You can ask them to vote to raise the caps. Join the NIH caucus, sign on to appropriations letters and policy, etc. There's a lot of things you can ask them to do, but these are the simple ones, the things you don't have to worry about trying to remember. They're really pretty simple. You can carry them around in your head for that opportunity, but you have to make the opportunity. It's not just wait until somebody happens into the Starbucks while you're there or the grocery store or someplace else. I want to get back to public opinion for a minute. Policymakers, people who want to be in elected office, pay exquisite attention to public opinion, both anecdotal, that in the media, and that we learn through polling. They may deny that they pay attention, but they all do. They all do. and often are commissioning their own surveys. We consider it the height of compliments to have a member of Congress or one of the political party apparati to take one of our questions and see if they can replicate it. And we know that goes on because they're doubtful or they think that, oh, this is kind of interesting, whatever. That happened when we were working on doubling the NIH budget, and there was a lot of skepticism that our national and state-based surveys that were showing enthusiasm at very high levels for doubling the NIH budget, they're doubtful about that, members of Congress. Newt Gingrich had a survey commissioned to see if his people would get the same answers. And they did, thank goodness. We all would like to have our data replicated. We know that's happened on many occasions. So we stand by the caliber of our surveys and we're clear why we do them. We do them for advocacy purposes, and then we do them to help us refine and keep a finger on the pulse of our messages and about the concerns of the public, and also to help our members do exactly the same thing. And that means you all as members. So I'll just run through a few more of these. People across the nation think it's very important or somewhat important. Pretty much everybody thinks it's important for the U.S. to remain a global leader. That is no longer obviously going to be the case, with China hot on our heels, and that can be quite a conversation to have with the media, with the member of Congress, with friends and family. Really eye-opening. I'm not going to go into detail about that, but there's a lot of information on our website about it. Sometimes in the science community, there's a sense that the public has turned sour on basic research. There is no data to support that. There is anecdote, to be sure, and there are those things like the Federal Waste Book and a new Federal Fumbles book that's come out. A lot of criticism about individual grants and so forth. But this finding, the response to this question hasn't changed in a significant way, statistically significant way, since 1982, which is when the National Science Board started asking this question, verbatim. It's the same level of support, and not sures and some disagreements. But the idea that that's tanking somehow is not based in evidence. A few other things. We have for some time been asking this question or similar questions about the importance of doing more research to eliminate health disparities. We know from focus groups that it's based on a sense of fairness. Americans believe fundamentally in fairness. And this is a way to bring out that agreement. Some other things I think quite troubling and worthy of note is that as much as we'd all like to think that the United States has the best healthcare system in the world, we actually objectively know that we don't. But the public realizes that too. And this number has been going down. I didn't happen to put the trend data on here, but that 30% has been trending down regularly, few percentage points a year for a decade. Very, very bad news, but true. And this one also has been trending in negative directions. Do you believe the healthcare services you personally receive are based on the best and most recent research available? Fewer and fewer people are saying yes. And they're not wrong, is the problem. But the idea that the public doesn't know what the inside the community knows is that we're not translating effectively all the evidence to the clinic, to the actual care of patients that we could be. That our systems do need to be value-based, et cetera. Slightly different note, this has been held about the same for many years, agreement that the government should prioritize STEM education and careers. with quite a few not sures, significant not sures. And this is true all over the country. Many of these questions we ask state by state just to see if we get differences, and we don't. We've recently been asking about opioid addiction, just to see if what we assumed is true, and it is, that there is support for doing more, a lot more, a lot more. And I think it's worthy of note that the administration appears to support more resources, including for research, also for prevention and for community engagement in really standing up and combating this dreadful, dreadful epidemic. Now, this is from Pew, but we have some similar data as well. But one of the things we do is keep track of what Pew and other groups are doing in surveys of relevant topics, like Americans' perceptions of scientists, science-based organizations, and the like. And so you can see here that is consistent with our data as well, that Americans do trust scientists. Now I'll say another way of thinking about trust in all professions and groups of Americans has been trending down, just overall, over time. Not dramatically, but just on a downward slide. But the ranking hasn't changed much. And scientists have stayed very much on the top. Elected officials are always at the bottom for the last 20 years or so. But they know that, and they want to be aligned with the people at the top, which is one of the reasons that elected officials like to visit science-based organizations, whether they're medical science or other kinds of science, and have their pictures taken that show up in the media. Because they know the public trusts and respects scientists much more than they trust and respect their member of Congress. That's the underlying, one of the reasons you should be inviting members of Congress to visit you as often as they'll come, and having big groups with you and take a lot of pictures and get them out to the media. So that's good news, right? But despite that, getting back to my invisibility theme here, think for a minute what the answer to the question will be. National Survey of the American Public. Can you give me the name of a living scientist? What percentage of the public will say, yes, got your mind? Can you give me the name of a living scientist? Well, no, I can't. And just for fun, I should tell you that when we started asking this question some years ago, I think it was probably 15 years ago, I said, can you give me the name of a scientist? And we didn't think about the living part. Number one was Einstein, yay. But we realized, oh, wait, that's not what we were trying to get at. So we got to living. We still get some no longer living scientists named, but they're in the sort of decimal dust at this point range, because stress the living. And you can see who is named. Your former colleague, Tony Fauci, is there. But the point we keep hammering on is this percentage doesn't change. The percentage doesn't change. What's new on this, just this year, is the 2%. That's not possible. It's not true that 2% of the American public are scientists. But it's nice. It's a feel-good thing, even if people are kind of having fun with it. If they want to be a scientist, that's good. So I'm waiting for the day that this is going to change. Actually, not just waiting. Hope is not a plan. I'm working on it. I want you all to work on it, too. Okay, think about this one. Can you give me the name of a place? Now we're talking about medical and health research only, by the way. Note that it's a shift from science to medical and health research. Can you give me the name of some place, any place, where medical or health research is conducted? This is not a hard question. Goes back to my Nebraska story, though. 2/3 of the American public just say no. No, I can't. Now you can see in the names that are mentioned the power of branding, the investment that those folks have made in branding. And NIH is on here, not at a very high level, but as is CDC. This hasn't changed for almost 20 years. It's got to change. It's got to change. Another one without taking you through the exercise. Very important politically. To the best of your knowledge, would you say that medical research in the U.S. is conducted in all 50 states? Which it is. A whole lot of people don't know, and a whole lot, 1/3, say no. Well, what if you're the senator from Wyoming and you never hear anything from your constituents about the importance of medical or health research, and as far as you know, there's none going on in your state because nobody ever talks to you about it? Why are you going to be a vote for more NIH funding rather than some other kind of funding? So it is really important that we overcome this invisibility and that we're self-identifying and identifying our institutions as institutions of research, of science. It's very important politically. It's important to your future personally. Increasing the invisibility of science, there's a lot of ways to get engaged in it, not just at your local Starbucks, but some more deliberate ways are listed here, tried and true in many institutions. There is one program that we know of, and we think maybe as recently as a couple weeks ago we found another one at the departmental level that makes it routine, required, expected, etc., for everybody in a department to be engaged in public outreach and advocacy. It's been going on for some years now, and Rick Eckert would be happy to talk to anybody about it any time. But the fact that there's only one, that we're in this business, this is what we look for, this is what we do, we've only been able to identify one such program. It's time to change. So I mentioned earlier, I hope you'll be sure to tweet out about raising the caps. That's the message media du jour, for better or worse. And we can't expect to change hearts and minds by clobbering people with data. It just doesn't work. Whether it's in science or anything else, that's not how you change hearts and minds. Please, Senator or Congressman or whoever, read my latest paper here. I'm sure it'll change your mind. Or please, Mary Woolley and ResearchAmerica, gather up the most important people in Congress and I'll come and give a lecture to them and then they'll be fine. That meeting isn't going to happen. It's an emotional activity, and I know that in the science community, the training is not to think or act emotionally. But it's at the emotion is at the basis of persuasion. It doesn't have to be inauthentic or inaccurate or bad. It's a way to connect. So I sometimes use this example, and especially today because it happens to mention Einstein. This was in the New York Times after Paul Greengard received his Nobel Prize. And his sister happens to be a journalist, Chris Case. So she wrote actually a quite long piece. And it brings out the point that she'd been talking to him for decades, and finally gave up, about what he did. That he was unwilling or unable to tell her in words that she could relate to. Those words are underlined here. They're the caveat that doesn't promise anything, but connects to something a non-science trained person is aspiring to, along with all of us, curing diseases. Might one day, my work might one day. So there's the caveat. You're protected. You're not promising, because of course you don't know. But that doesn't get said often enough. But it did appear when Chris Chase wrote her column here. It was so striking to me. There's a really simple formula that we recommend for talking about what you do. It's called Then, Now, and Imagine. Just 3 kind of bullet points of how to talk about your work in a way that connects on an aspirational level to the non-scientists that you're talking to. Don't ever call those people lay people, by the way. They resent that. It's like a priest class and a lesser relationship. They're actually the boss. They're the people paying the bills. They just don't have the same training you do. So this one happens to do with HIV/AIDS, but it can work with whatever each of you, any of you, is working on. You start out with the back in the old days bad news information. And depending on what you're working on, in the old days could be 5 years ago. But let's just say for HIV/AIDS, HIV/AIDS was a death sentence, guaranteed back in the old days. Now, thanks to the investment this country had been making in basic research for decades, we now have the ability for HIV/AIDS infected folks to have long and productive lives, not unlike diabetes. We haven't reached the end goal here by any means, but we're going to get there if we sustain our commitment to research. Now you're aligned in aspiration, and you've connected some dots to people without going into paragraphs and chapters and books of the history of science, or even talking about science. There's other ways that are, sort of more fun ways to have a different kind of conversation with people. And this goes to the money points, because people may hear, well, I hear we're spending billions and billions of dollars of taxpayer money to cure diseases that we're nowhere near curing, et cetera, whatever their version is. But if you have, just as you're listening to the news day to day, and it's important, obviously, important to be topical and in the moment. I hope you don't have snowplows running here this afternoon, but you might read something like this, or you might read that the Super Bowl advertising by, every 30-second slot costs some billions, and you can compare that to either the NIH overall or to one of the institutes of the NIH, to something else, just to give people a feeling of what ballpark are we in. We have a very rich country here. Nobody's suggesting taking away snowplows. We might suggest taking away football, but that's another topic. But the point is, there's money. The idea that we don't have the money is silly. We can't buy into that. We can't buy into the trade-off argument either. Less for some kinds of federally funded things because we need more for something else in this fixed pie idea. That is silly. We're trying to assure a healthy, prosperous, secure nation into the future. That might cost more. It might cost more. We ought to have a nation worth defending, after all. Worth defending. It's important that we have a nation well defended, and we will. This number, 587, likely will go up to closer to 700 billion in a few weeks' time. The NIH number isn't going to go up that much. Nothing close to it. A nation worth defending. Don't be afraid to talk about big numbers, but don't trade off either, because priorities are important, priorities of all kind. So just a recap, thinking about talking to non-scientists. I think remembering that skepticism is healthy is one of the most important takeaways, if you will. But so is conveying passion, your commitment and your passion, not being afraid to do that, and to put your face on research, to stop being invisible except among your colleagues in terms of your identity as a scientist. I think the most important 4 words that you can convey in what you're saying and actually say, when somebody says to you, so what do you do? Kind of has lost track, maybe an older relative, or someone you just met. What do you do? Say, I work for you. And you might get some funny, oh, yeah, would you lift this suitcase into the overhead rack? Maybe you could do the dishes. haha. But they're going to say, what do you mean I work for you? Well, you pay taxes, right? Oh yeah, I hate paying taxes. Some of those taxes go to fund my work and my colleagues and scientists all over the nation. They get to us via the National Institutes of Health, you know, the NIH, and they may have heard of NIH, but actually a lot of people don't know what those letters stand for. Anyway, what you want to do is have whoever you're talking to ask you questions, which you will be able to answer. And if you can't, you can find out the answer, because you could get into, gosh, I hate to think about this new diagnosis that I or somebody in my family has. And you may not really be able to comment on that, but you can give them good advice about where to get information. The point is to make a connection and to say, I work for you, not say, I'm a virologist, I'm an immunologist, the list goes on. Say, I work for you. It works. And it'll make you feel proud, too. And I'm very fortunate. I work for you. I want you to succeed sooner rather than later. And I thank you for the opportunity to talk today.
Truly a remarkable, wonderful, and inspirational message, and we're so
Thank you, Alan.
we're fortunate to have such a leader and advocate. I think we have time for just a couple of questions, if there are any.
Anybody
For
comments, disagreements.
Don't be shy.
Right.
And you know, I might start off really quickly with one which you alluded to, with might one day. Mm-hmm. The sweet spot between over-promising, over-hyping, versus not saying anything at all. How do we address the public? I'll be very specific and concrete. Some of the students know that I'm on the elliptical machine every day, but I'm watching CNN, and a 33-year-old man with ALS, speech already slurred, a passionate advocate, as we heard, of patient advocates. What do we say to people with a disease like that and other examples? How do we frame that message in the right way?
Yeah. Well, I'd say that much of it is situational. You know, just being sensitive to who's asking you this question. Does it look like that person is the 33-year-old man who's facing very difficult times ahead? But offering people hope is the most important message to convey. They have every reason to hope that science will continue to make progress. At a date certain, no. But making progress with one hand tied behind our back, which is one way of describing the current level of opportunity, well, the opportunity is huge, the level of support, money, to fund that opportunity is the equivalent of one hand tied behind our back. Many people don't realize that we're not doing all the research we can. And that's getting into that conversation stuns people. They can't believe, are you kidding? That every scientist whose proposal is acceptable to the NIH can't be funded? What? You know, what's the matter with this country? Why aren't we doing that? And the analogy to defense is an excellent one in this regard. You know, defending this country is so important to us that we pay for educating the leaders of our military. There's a parallel here to science, of course. A long education, expensive education, and then they move up into the system before a few of them become five-star generals, etc. But all along the way, we pay richly, and nobody questions that. It's important to defend the country, and all the rest that goes with it. There's an interesting analogy there that you can play out if you're talking to the right audience. But saying, well, I can't promise anything as a starter doesn't help. Yeah.
But I think the clarity and articulate nature of the presentation satisfied folks. And it may also be that there's some pizzas out there for lunch and some other things. So I welcome you and thank you so much again.